So PAE stands for Prostatic Artery Embolization, and the idea is that as men age, the prostate can become enlarged. It's called BPH, benign or non-cancerous prostatic hypertrophy. Hypertrophy means enlargement, so just a non-cancerous enlarged prostate. And when that happens, patients get symptoms with urinary frequency, having to get up a lot at night and go to the restroom, having to feel like they have incomplete emptying of their bladder, and just frequent urination, having to make multiple trips to the bathroom. And so traditionally the treatments for that have been medications, which work for a while. A lot of times when patients get past the point where medications are no longer working, then there would be the transurethral therapies, meaning that the physician will go up through the urethra. Traditionally they would do what's called the TURP, which is a transurethral prostatectomy. They go up and they would cut out part of the prostate to improve that flow going through there. The issue with that is that you can get incontinence, you can get impotence, you can get recurrence, and so it's a valid therapy. It's being used less and less now with less invasive options. Sometimes the doctors will go in, they'll try to either they inject steam into the prostate to shrink it, or they put sutures in there to try to open it up. Those are all the options where you can go through the urethra. But the issue with us is we found a way to go in, as opposed to going in and directly operating on the prostate itself. We go in through the artery that goes down to the prostate. We inject small little particles that go out to the prostate to decrease the blood supply going to the prostate, and then the prostate will shrink on its own. And the idea is that you get volume reduction of the prostate without actually having to go in and doing instrumentation. And so that procedure is done here in the office. Usually patients come in. We'll have an anesthesiologist here to give you some medicine in your IV to help you relax. Patients usually fall asleep on their own, but there's no breathing tube or ventilator. And then we go in either through the artery in the wrist or the groin. We put a small catheter out into the artery going to the prostate, and we inject those particles. Procedure takes about an hour. Once we're finished, we roll the patient back to the recovery room. Once they wake up from anesthesia, something to eat, something to drink, go to the restroom. They go home a couple hours later.